Choosing the BMT program here at Baptist Health gives the foundation to the nurse for the education, along with the ability to deliver the best care. The opportunities of a nurse to work at a magnet hospital is a foundation that provides the nurse something to look upon as a stepping stone. It is the voice of the nurse that is given the opportunity to help guide the practice here with our patients.
We achieved or performed more than 130 transplants at this time, and we will likely perform more than 120 transplants per year from now on, if not more.
Baptist in general just gives you all the tools that you need. As a new grad, they put you through a specific residency. They teach you the Baptist way and they guide you through everything, and there's always someone there that you can ask questions to. They paired us with a BMT nurse, and they tried to provide as much experience with the BMT patient. And as a new grad, that's very important.
You are given that foundation, that education, the support and competency that is needed to be able to deliver the best care that is centered for our patients and their families.
This is a perfect opportunity for somebody to feel a sense of family. We've been working together in an environment that is conducive to both learning and taking care of our patients.
When I came here, they gave me possibilities to become better at what I do. I used to work for another institution here in South Florida. I loved my job. However, I realized I wanted to be a part of an institution that made me feel like a family. I wanted to come to work and feel like my team was united.
I think that one of the beautiful things about being on a brand new unit is the community that we fostered. That sense of community, that sense of teamwork, I believe is very strong on this unit. All the nurses know that they can go to the leadership team, they can go over to the nurse educator, to anyone that's in leadership, and they can count on them for absolutely anything.
The support that we have from our clinical educator is absolutely stellar. I mean, I can't imagine anyone being able to do the things that she does.
Baptist Hospital really values education, and one of the ways that we do that is through our residency program. I've seen multiple transplant units. I have to say that our training program for new graduate nurses as well as for transitional nurses is one of the most extensive that I have seen.
Baptist does offer clinical ladders and also advancement, where you can start off as a bedside nurse and then transition into either a nurse educator or advanced practice registered nurse.
As an expert nurse, I had the opportunity to identify some needs that our patient population might have. One of those needs was that sometimes the patient have the conditioning, during the treatment, during the BMT, the transplantation time. If they don't exercise enough, they can get the condition, they might lose functionality. So I was able to identify that the patients were needing to exercise more, to integrate physical therapy in their treatment.
Just being able to have those resources and that support from the leadership, I mean, that's definitely one of the things that makes this place different.
The great thing about Baptist is that they really do support every nurse in order to obtain their certification to validate magnet status.
We have lots of learning opportunities and growth, an environment for growth where you can look at things in the leadership and education. We have students that are studying here. We've been able to really grow the program from start to finish.
The most important thing is to be working in a place when you know that you're going to have opportunities to grow and you're going to have opportunities to be supported.
The great thing about our team is that it's multidisciplinary, and we have a good group of physicians, advanced practice providers, RNs. We work with social workers and case managers, pharmacists, dietitians, and physical therapy in order to accomplish the best for our patients.
I provide support to the nurses and staff here, as well as the patients, providing spiritual, emotional, and psychosocial help to all.
If you're a nurse who's into learning and growing, this is the place to be.